Welcome back to The Line. New Mexico expanded Medicaid under the Affordable Care Act during the Obama administration. According to the State Department of Health, more than 830,000 New Mexicans are enrolled in Medicaid. Think about that. Now, that has raised the cost of the program, as we have reported here at this table, but some lawmakers believe adding even more people who will voluntarily sign up could help. Could Medicaid buy-in be a good thing for New Mexico, Tom? I really want to get some underneath the skin of this here. This is a very interesting proposal here that has a lot of good things for New Mexico if you really kind of step back and look at it. What's your sense of it?
Yeah, just first disclosure, we have clients in the healthcare space, but my comments are my own.
Appreciate that.
With respect to Medicaid, I think the proposals that have been laid out already in the legislature are really fascinating. It positions New Mexico as a thought leader with regards to how do you expand Medicaid.
Right.
And I think that the Medicaid Light, for lack of a better term, proposal has a lot of real positive attributes because it'll get more people on the rolls.
Right.
Insurers like when you have more people on the rolls because that helps everybody. That it creates a nice sized pool. The question is how would it all mesh together, and could it mesh together? But I think that's one of the reasons of the two types of legislation we saw in the legislature is how could this all work together? But so far, it appears New Mexico's in the driver's seat on what could be a very important issue on the national level.
Good point there, Sophie. 14 or so states are looking at this, but to Tom's point, we could lead here. This could be very interesting.
We're not at the very forefront, but we're pretty close. I mean, there are a
Right.
handful of states that are a little further on than we are, but we have been studying the issue. Our legislature put that into effect, and so I think that that's been quite helpful. I would express some general support in the same way that I think Tom has for the idea. I think that it could address some real issues here. The devil's always in the details, and so when we talk about people who currently appear to be unable to afford insurance buying into a program, that they may find that there's still some of those same issues that could prevent people from getting in there. There was an interesting sort of side note in one of the pieces that I read that I found sort of fascinating, the idea that you're in unless you opt out. And this wasn't for this particular plan, it was for a different bronze plan, not currently, I don't think, being contemplated in New Mexico, but you're in unless you're out, and you just pay your co-pays. I mean, if we can find something that kind of no-brainer for people, where they don't have to make extra effort. Economists, sociologists tell us that social scientists tell us that can be quite powerful. You have insurance no matter what. The closer we can get to even that idea, you have insurance no matter what, I think the better off we'll be as a state. One thing that really disturbs me in this conversation, and I apologize in advance if I steal anybody's thunder, is the idea that we don't have enough doctors and therefore people shouldn't get medical care.
Thank you.
I think that's a terrible argument. Y'all should put that away right away.
And hopefully, yes, that's a whole other, I hear you. What it isn't, this idea, is Medicare, is the idea of single payer for all. And that's not what this is.
But it's a step towards
But it could be a step towards that. Does that help Medicare? Does that help single payer in the long run, do you think?
I think
it
does, based off of MIT studies that were done with Medicaid models and Medicare models in the long term. They look at cost-saving measures and stepping stones. So Medicaid being one of them right there. If we can lower the overall amount of cost in the healthcare markets by doing preventative care, by getting Medicaid-like care that we can catch things early on, we can provide that basic line of coverage, then it works. It's a bipartisan deal on that point. Republicans like to talk about lowering costs and being able to put more revenue back into the state's coffers and stuff like that. Well, you do that by driving the cost down and doing preventative care like this. This is what Medicaid could do.
That's right. Diane, when you think about it, Sophie mentioned just before we started airing this, she helped us all get straight. Medicare is the feds. Medicaid is state-run, and a lot of folks don't know that. And so there's good opportunity here when you think about it, which I think is why you're seeing one of the gubernatorial candidates talk about this. My anticipation is the second one would be talking about this at some point soon. As a legislator, how does this strike? Is this back of the envelope doable to you, that Medicaid for us here to fill in a lot of gaps? Does this feel like something that's doable for us here?
The bottom line is it's going to cost money.
Okay.
And where are we going to get the money?
Gotcha.
On the bad years. Because once you put someone into a program, you can't reasonably take them out.
Right, that's right.
The other 2 points that I think have not been discussed is, as I've read this not only includes poor people, it includes people who are underemployed. But the piece that nobody mentions is it also includes undocumented workers. You know, that's a different argument.
Right.
Being supportive of somebody who's working 2 jobs and has children and makes too much to qualify for Medicaid, but doesn't have enough money to buy private insurance, to help them and set up a program, most people would say, yeah, we got to do some help here. These are good citizens of New Mexico. We need to do this. But do I want to spend my money doing undocumented workers? Now, the other side of that is, of course, and Sophie mentioned a little bit about doctors, but emergency care physicians are required by law to provide services to anybody who shows up at an emergency room. So if we don't do something to take care of the people, this is back even the ones who are underemployed.
That's right.
They are going to an emergency room.
That's our system.
We
Yep.
certainly don't have enough emergency room physicians. We don't have enough emergency rooms themselves.
Right.
If you go into hospitals around an emergency room, you will see patients lying in beds lining the hallways. So there's a lot more to this. The concept is lovely.
Yeah.
But when you get down into the nitty-gritty,
Yeah.
there's a lot more to be considered.
Glad you got that on the table. That's a good point there. Tom, when you think about something the Senator mentioned a second ago too, is the money part. We didn't do quite well with this the first go round, even with a 4-to-1 match out of the feds. Do you know what I mean? The money got away from us a little bit. Do you share the concern the Senator has that the cost could get
Oh, yeah. Whenever
out of control?
you have, relying on the federal government, as we've seen with our state economic development plan, to rely on the labs and other federal funding, just is not a smart business move. So relying on the federal government to continue that same level of payment is not a good move either. I think it's something that has to be taken into consideration. I think it's something that you could potentially get insurers to the table to talk about. I think this is a great opportunity for Superintendent John Franchini to really kind of take this under his wing as superintendent of insurance to say, you know what, this is important for the state moving forward. Let's get everybody to the table and see what we can work out.
Right.
And so he has that ability to get everybody around the table. Whether or not everybody will want to talk is a whole other issue. But I think it's a real leadership opportunity for him.
Good point there. You know, when you think about it, Zach, it's got its own hashtag. There's a chant, Medicaid for more. You know what I mean? It's got this momentum.
And
you
you
can
have to-
feel something growing here that it just makes a certain logical sense, even given what the Senator mentioned a second ago. But just as, not so much of a stopgap, but we have a third of our population
Completely.
on Medicaid. So it would behoove us, it would seem to me, to go into the problem. If Medicaid is the issue, let's just go there and see what we can dig out.
We can
would
dig out
a
some
new
great-
administration be well served to take that approach, take that
I believe they
attitude?
would. I
Okay.
believe, a new administration focusing on an effort like this, regardless of a person's status, because
Right.
it all goes into one single cost for everybody. Doesn't matter if you have American citizenship or you pay taxes and you pay into the American system but just don't have the title American. We all bear the cost, and that would be the point. And I think that's the main target for the next administration would be, all right, how do we cover as much amount of people as we can to overall costs in the healthcare insurance markets? And we talked about economic development here before, and we said the largest sectors of growth are going to be both education, but especially healthcare. Specialized care is going to come into the highest demand here in New Mexico. We have an aging population, but also on that, we have household income levels that haven't seen rises in about 6 or 10 years. I mean, we're still hitting that, but that's where coverage comes in.
To Zach's point, I think that there is an opportunity for Governor Martinez to really kind of grab this issue. I mean, after all, it was the governor who expanded Medicaid coverage for all residents in New Mexico. It would be a great way for her to kind of put a period on her administration to say, you know what, this is how we started, and this is how we're going to end by looking out for New Mexico's most vulnerable.
That is a great idea. Glad you got that in. Thank you all. Have to end that there.